IBMers, possibly as many as 70% of us, will be affected by some degree of dysphagia or difficulty swallowing food and sometimes liquid caused by our inclusion body myositis distressing the upper esophageal muscles. Another area of concern are those that are suffering from GERD or Gastroesophageal reflux disease. GERD can cause a lot of sleepless nights for those that have it, and I'm going to share a few tips to IBMers to help diminish the GERD situation. Hi, Jerry here again on the channel dedicated to IBMers in all stages. GERD can be a serious obstacle in many people's daily lives, including IBMers. It robs us of enjoying our normal eating routines and also at night when trying to sleep in a supine or side-laying position. GERD occurs when stomach acid flows back into the tube connecting your mouth and stomach and is caused when the lower esophageal sphincter muscle weakens or when the body's diaphragm interferes with that area near the entrance to the stomach. Most people can manage the occasional discomfort of GERD with lifestyle changes and over-the-counter medications, but some people with GERD may need stronger medications or even surgery depending on its cause. Let's be a little more specific about our definition of acid reflux. If it occurs to you only occasionally, let's say twice a week or less, your problem is probably just GER or gastroesophageal reflux. But if it occurs twice a week or more, it may be more of a chronic condition, which changes the label to being GERD, gastroesophageal reflux disease. When some contents of your stomach back up into your esophagus, an acidic taste and slight burning sensation can be felt in the esophagus and even in your throat. Sometimes GERD can cause problems in your throat. It can make you feel like you have a lump in your throat, or like you always have to clear your throat, or have excess mucus in your throat. It can also cause some hoarseness. You might be more hoarse when you first get up in the morning. Conditions that increase your risk of GERD can include bulging of the top of the stomach up to the diaphragm, called a hiatal hernia, connective tissue disorders, delayed stomach emptying, or obesity. Factors that can aggravate acid reflux include smoking, eating large meals or eating late at night, eating trigger foods such as fatty or fried foods, drinking certain beverages such as alcohol or coffee, and taking certain medications such as aspirin. I've had several bouts with acid reflux, probably from eating too much. When eating, I sometimes have a tendency to maybe overeat and overindulge. Eating too much or eating too late may set up your stomach for a bout of acid reflux a few hours later. At least it does for me. Another precursor to acid reflux might be reclining in your recliner chair too soon after eating. It's recommended that we sit in an upright position for at least 2 hours after eating to allow normal digestion of food in the stomach to begin its normal process. Here's another twist. As we've already said, with GERD, the lower esophageal sphincter does not work properly. This allows stomach acid to back up into the chest, usually causing the telltale sign of heartburn, but the properly functioning upper sphincter does not allow it to enter the throat. With laryngopharyngeal reflux, or sometimes referred to as LPR or silent GERD, neither sphincter works correctly, and the backflow of stomach acid and digestive enzymes can wreak havoc on the esophagus, as well as the ears, nose, throat, vocal cords, sinuses, mouth, and lung. This may be more prevalent in people with IBM, as the throat muscles may already be compromised by their dysphagia. So, what have I done to help eliminate the occurrences of GERD? I've done several things that quickly eliminated the occurrences of a severe attack of GERD that I was getting 40 minutes after laying down in bed night after night. First, I asked my wife if it would be okay to eat our big meal of the day at noontime with just a small sandwich or snack later in the day. Secondly, I cut back on my eating portions and eliminated my usual nighttime snack. My doctor prescribed me 40 milligrams of omeprazole, stating that this prescription was about 1/3 the price of the over-the-counter med called Prilosec. Sure enough, the 30-day supply of this prescription medicine was only $3, whereas the over-the-counter brands were much more expensive, plus was more reassured of taking this treatment medication with the acknowledgement from my doctor. Another action that I tried in addressing my GERD situation was to raise the head end of my bed. Although this partially worked, it also caused a problem for me, as it caused me to slide down in bed a little and hindered raising the head end of the bed when I wanted to sit up in bed to go to the bathroom. I'm more than happy to announce that my occurrences of GERD no longer affect my daytime or nighttime life. The few changes I made also answered the buildup of an overabundance of mucus in my throat, sometimes to the degree that I felt like I was drowning in my own saliva. If you suffer as a result of having GERD, I suggest you find some relief by making some small lifestyle changes that I've mentioned in this video, along with mentioning it to your doctor during your next visit. Life with IBM is tough enough without having to fight the rigors of gastroesophageal reflux disease or GERD. If suffering from GERD, take note regarding when you are eating, what you are eating, and how much you are eating. Modifications in any of these three areas might provide some simple relief for reoccurring GERD attacks. If you still have a problem, make sure to get in contact with your doctor at your earliest convenience. If you haven't already done so, please subscribe to this IB Myositis YouTube channel. Make sure you have that bell pressed if you want to be notified whenever a new episode has been published. Stay healthy, my IBM friends. See you in the next episode.